Hi, everyone. Thanks for joining us today. We're just going to give it a few more minutes to let other folks join, and then we will start the presentation. All right. Thanks, everyone, for joining us. My name is Elizabeth Everett, and I'm the Deputy Director at First 5 Nebraska. I'm going to hand it over to Aaron, who will be giving our language justice statement.
Hi, everyone. My name is Erendira Mauricio. I'm here with the CLC to create a space for language justice. I'm here to interpret. For those who are Spanish speakers, there will be a global icon that you can select if you want to hear in Spanish. For those folks who are bilingual, you do not have to do anything. And for English, you can just go ahead and choose for English main audio. And that is all. We'll do an audio test after that.
Sounds good. I'm going to go ahead and start the interpretation now. Yeah. All right. Thank you. I'm going to go ahead and share our screen now. All right. Thanks again, everyone, for joining us today. As I mentioned before, I'm Elizabeth Everett at First 5 Nebraska. We are a statewide public policy organization focused on supporting policies that impact children and families, especially those that are most at risk. I am joined today, by my colleague Mitchell Clark, who's a policy advisor, and Jody Renee Jerome, who is the grassroots and advocacy advisor. Mike Ledwick was also able to join us today, and he'll be discussing some of the tax credit information towards the end of the slide. So just a couple of important dates. So as always, we start these presentations off with giving you guys the details on what's happening and what's coming up in the future. So as most of you know, we are in a long session. So right now, the session is slated to end in the beginning of June, around June 8th. Right now, we are also finishing up hearings. So the last day for public hearings will be March 28th, and then full day floor debate will begin soon after at March 31st. Right now, the floor debate is only in the beginning, in the mornings, and then the hearings are still happening in the afternoon. So fortunately, March 31st, you'll probably see some things hopefully pick up a bit quicker. But right now, especially with only having half a day to get through bill discussion, some bills, most bills have not been moving. We're fortunate to have bills prioritized last week. So both senators and committee members and the speaker identified bills that they will have as a priority for this session. So all senators, they get one priority bill designation, committees get 2, and then, the speaker gets 25. So all those were announced. Those priority designations were required by March 14th, so a little over a week ago. But with those designations made, we now know what the rest of the session will most likely look like, right? Because it is a longer session, because there are those fiscal constraints that we've talked about in the past, it's going to be really hard for bills with fiscal notes to move forward. Yet we do know that most of the bills that have been prioritized, if they are on general file or if there's general support for them, they will get time to be debated on the floor. April 8th will be our next policy call. So again, as a reminder, we are only doing these policy calls in the afternoon and no longer in the evening. So we will have these at 1:30 p.m. every other Tuesday still. They will be a recorded option that you can go to on our website to view the presentation if you are able to join. And then we also, again, will have the PowerPoint presentation available to you. Before I hand it over to Mitch, again, just a reminder that the bills that we go through each presentation will only be the bills that have had movement from the previous PowerPoint that we discussed at last time. So the ones that we will, again, go through are the ones that either just had hearings, there was some recent movement on the floor with these bills, or ones that were prioritized. So I'll hand it over to Mitch to go ahead and talk about the first one.
Thank you, Elizabeth. Hi, everyone. Mitch here. I am a policy advisor with First 5 Nebraska. I work in our child care and early education policy work with state legislators. The first bill is LB 13 that we'll be discussing. This is a bill which would require the Department of Health and Human Services to file a state plan amendment for child care subsidy for enrollment-based reimbursement. The bill had a effective date that was sooner initially. However, on the first round of debate, general file, it was amended to push back that implementation to 2026. As we all know, the department is already planning to implement enrollment-based subsidy. It has a waiver, so it has until 2026 to implement that waiver. So the amendment that was adopted would align with the implementation timeline the department is currently using. This bill would provide a funding mechanism for the department through this bill. Otherwise, the department, as it implements the enrollment-based subsidy, it will have to submit a budget deficit request. And this bill did receive a priority from the introducing Senator Michaela Cavanaugh.
Before I move over to the next slide, just one thing I want to emphasize is that this bill right now, we do not know when it will come up for debate again, especially because it has been given that priority designation. But we will be notifying folks through our social media channel and on our website, so that if you wanted to tune in, you can.
The next bill I will be discussing is LB 442, introduced by Senator Ashley Spivey. This is a bill which would establish a state child care subsidy program. It is similar in concept to the current subsidy program that we have funded through federal dollars. However, this bill would provide a state funding source by implementing a payroll tax that everyone working in Nebraska would pay to fund the program. This bill would implement eligibility up to 400% of the federal poverty level, so far exceeding where our current eligibility levels are. It was heard a couple of weeks ago and is still sitting in committee. This is a bill that First 5 Nebraska is supportive of. We are happy to have this conversation around subsidy and supporting working families and the economic benefits for this state in investing in childcare for our workforce and for families. Next slide, please. LB 248 is a bill that was introduced to exempt childcare programs which are on military installations from state licensing requirements. These programs are already licensed under the Department of Defense, and so they have their own set of standards to adhere to for childcare licensing. It was advanced from select file on March 18th. Next slide, please. LB 457 is a bill which would require schools and childcare programs to implement anaphylaxis policies. For licensed childcare programs, they would have to have a written policy in place which details how they will prepare for and respond to incidents of severe allergy exposure in their programs. The bill directs the Department of Health and Human Services in conjunction with the Department of Education with developing a model policy for childcare programs to use. They are not required under this bill to use that model policy, but they do need to have a written policy in place. Next slide, please. LB 157, introduced by Senator Daniel Conrad, would adopt the Child Tax Credit Act. This is similar to the federal child tax credits in that it is a refundable program for parents. However, this is specific to parents with children who are 6 years of age by the end of the taxable year and under. So this provides tax credits for families with young children. It is a refundable credit of $1,000 per qualifying child. And there are certain income eligibility guidelines to receive the full $1,000 tax credit, which is up to $75,000 for single, $92,500 for head of household, and $110,000 for married filing jointly taxpayers. At higher income levels, it incrementally reduces the amount of that credit depending on the household income. And that was heard last week. It was a bill that First Five Nebraska supported. Next slide, please.
So now I'm gonna.
I will pass it on to Elizabeth.
Yep. So as you can see, we went through several bills, right, that we did not discuss. That's because those bills have not had movement on them. Again, unfortunately, because of where we are with a long session, with the amount of bills that were introduced and those that were prioritized, with our fiscal shortfall, unfortunately, right, still over close to 290 million that the state has to find. Bills that are moving are those that do not have a fiscal note, so any money that's required to implement them. The ones that are not moving, right, are those that have either a large fiscal note, do not have enough broad support, or again, have not been brought up for debate. So while we understand again that folks might ask, like, well, why is there not as much movement? I would say that we have been fortunate to see some bills already signed into law. Those are the ones that we discussed at a previous call. Bills like LB 51, LB 182, which will again support families and children. But as always, because of the money and because again that some bills did not get designations, some of our priority bills for this year will not be moving forward. Our hope is that maybe we could find some pathway for some of them, but there is no guarantee. So what will happen is that these bills will get carried over into the next session. So that's childcare. Maternal and child health. Normally Sarah Howard, a policy advisor at First Five, discusses these bills, but she is out on maternity leave. These bills, we've actually seen a significant amount of movement on the ones that we've supported. So LB 41, right, was a bill that again would change the requirements for pregnant women to get screened for syphilis more often than they are right now. This bill did move back to select file specifically for an amendment. The amendment basically provides a pay for. It states that if there's any additional funding required to pay for those additional screenings, it will be paid for by a specific cash fund. So it adopted that amendment on select file, and then it advanced again to final reading. So it's on final reading right now. I think that bill will most likely, again, unless something crazy happens, will get signed into law. We had another hearing that First Five Nebraska submitted a letter in support of, which was the Paid Family Medical Leave Insurance Act, had its hearing on March 17th. We did again submit a letter of support because we weren't able to be there in person. For us, again, having access to paid family and medical leave insurance is an important issue for families and children in Nebraska, and we are fully supportive of that. So while we don't anticipate this bill probably getting out of committee and moving forward, we did, again, support it on the record. LB 224 was another bill that we had submitted a letter for. It would allow for paid maternity leave for state employees. We highlight this one specifically because Senator Gareca, a freshman senator, has identified this as his priority bill for the session. So we will watch it to see when it gets scheduled for debate, or if it will be included in another bill as an amendment. So those are our maternal and infant health policy bills, excuse me. Several of the other bills, again, they did have movement on them, but I'm not going to discuss them this time just because we discussed them at a previous call. But if you do have any questions, please leave those towards the end and I'll answer those for you. I'm now going to hand it over to JR, who's going to discuss an exciting opportunity that many might be able to apply for with our Policy Leadership Academy.
Yes, thank you. So we are getting ready to open the window for our 7th cohort of the Policy Leadership Academy. For those of you that are unfamiliar with it, this is a 6-month program that takes a deep dive into how to influence policy and how to mobilize and influence people at the local and municipal level. We typically limit it and cap the participants. So for the next month, you might be seeing some more information on our website. We'll also be hosting a Zoom call on April 22nd at 1:30, where you can learn more about it. We can answer some questions directly, and just keep an eye on that webpage. You'll see some more information popping up, and also you'll be able to access the applications there when they open in May. If you have any questions along the way too, or you'd like more information in advance, please feel free to email me. I am happy to answer any questions you have. And we will look forward to seeing who wants to jump in and have a good time for cohort 7. Oh, and look, Robert's given us his credentials. He's a great advocate. All right. And then Elizabeth, do you want me to talk generally about engaging in our advocacy work?
We'll do that at the end. I'm going to actually hand it over to Mike, who again was fortunate enough to get back from an appointment to join us today to talk about the tax credit survey.
Sure. Thank you, Elizabeth. So with the final weeks of tax season now upon us, now is the time for folks who have either applied for the child care tax credit or school readiness tax credit to give us their input on these programs. We're encouraging applicants to do that by taking short surveys about their experiences with the credits. And what we really need is to hear the perspectives of applicants on the application process generally, whether or not that their applications were approved. We need to hear about their experiences with the process. And we also want to hear how these credits may help or will help those whose applications were successful. So we need to hear the good and the bad about the tax credit program so we can move forward from here. So there's a separate survey for each of the refundable and non-refundable versions of the child care tax credit and the school readiness tax credit. And you can find those surveys on the tax credit campaign websites shown on this slide. And I'll share those links in the Zoom chat window for your convenience. But Elizabeth, could you just click on that first one, the child care survey? Okay, so what you're looking at here is the web page for the surveys for the child care tax credits. This is for the refundable child care tax credit for parents with young children, the non-refundable child care tax credit for contributors to child care, and then we have a third one for recipients, for child care programs who are recipients of qualifying contributions through the non-refundable tax credit. So we want to hear about all of those different perspectives, and these surveys are available both in English and in Spanish. If you click through to any survey, you will get a Spanish link, as well as if you choose to take the credit or take the survey in that language. So similarly, if you close this window, Elizabeth, and open up the one for the school readiness tax credit, looks very similar. We have separate surveys for both the refundable and non-refundable credits here. So if you applied for any of these credits, we encourage you to take 5 minutes to share your thoughts with us by taking the survey. If you have contact with families or childcare professionals or programs or contributors who may have been affected by the credits, we encourage you to share the links with them as well. Again, this is rather important because, quite simply, we need the feedback we receive through these surveys to help ongoing efforts to improve the accessibility and effectiveness of the credits moving forward. So it also reinforces with lawmakers like the importance of these and similar supports related to childcare. So please do consider taking the survey if it's relevant to you, or sharing the survey with those with whom you have contact. And I will go ahead and drop those links into chat now. Elizabeth, that's, I think, all I have to say, but if anyone has questions, please do feel free to reach out to me.
Okay, and I'll hand it over to JR to discuss our advocacy, and then we'll open it up for some questions.
Yes, thank you. So we regularly talk about different ways to get involved, and there's multiple platforms and contexts, whether you are eager to get deep in the weeds on it or just want to know when you can help move something across the finish line. And I'd love to talk to you about that more. There really are ways we can educate and invest the communities in these issues, both early childhood and maternal health, before the sessions even start. So I think too that based on the conversations we've had and the information that Elizabeth shared with you, we can see that coming up is going to be a time where we really need to be intentional and coordinated in educating not just our legislators, but those who have stake in our communities. And the more we can do that in a coordinated way and with data that is credible and relevant, the more impact we're going to have. So if you are interested in knowing more about that or in getting involved in whatever capacity you feel comfortable, please email me and we can talk about that more. And then just know too, as we get close to the end of session, I will be reaching out to people and asking them in key moments and key places to take some action to help influence the legislators that are currently working on our issues. So please reach out to me. My email is there, and I'm eager to talk to all of you.
Great, thanks, JR. Now, if anyone has any questions, you can put them in the chat or take yourself off of mute and ask them out loud.
Elizabeth, Jessica had dropped in. She's wondering how LB 157 is separate from the child care tax credit. If you or Medwick want to answer that.
Yeah, so, and Mitch can hop on here. So the one that so the child care tax credit that we had passed in LB 754 a couple of years ago is specifically for those families who have children in licensed care. There is a component of it that says that if you are at 100% federal poverty level, you would also be eligible to apply for the child care tax credit. We mostly identified that population because those are families that go to Head Start. And so we didn't want to exclude them in the Child Care Tax Credit Act that passed again a couple of years ago in LB 754. The child tax credit that Mitch mentioned is different because it's, again, not tied to childcare. You can use it for childcare purposes, but again, to be eligible, you just have to, again, meet a certain income threshold, and then you have to have a child between a certain age range. So for that one, anybody, again, who has a child at, again, birth age 6 would be able to receive a credit of a certain amount as long as they, again, didn't have an income over a certain threshold. But ours, specifically, you had to have children in licensed care unless you're at the 100% FPL. What other questions? hopefully these calls are helpful, right? Again, if they are not helpful, or if you would like to see something different, we would love to get that feedback. We did send out a policy call survey, and for the most part, people who responded said that they really liked these calls. They did ask maybe for more opportunities for dialogue, and so we're thinking through that. We just know that there is a ton of information available and things that we need to go through. But I think that's something that we might be thinking about, is how to open it up so that there's more interaction during these calls. All right, well, that's it. Thanks everyone again for joining us. As a reminder, the next call won't be until April 8th. Have a great rest of your week.